Hello, I'm Ashley Sellers, speech language pathologist and owner and operator of Speech, Language, and Beyond. I'm coming to you all today because I wanted to do a really quick video about some of the toys or activities that I use with my children that come in that have low receptive language skills and very low expressive language skills. And just to kind of give you a quick review of what that is, these are your little ones that are coming in as early as 15 to about, I'll say, 30 months. They're coming in. They have very low receptive language skills in that they're not understanding and following directions. They're not making eye contact. They're not following through on commands. And then also they're not using words or any type of utterances to be able to express their needs and their wants. So they're mainly utilizing crying, pointing, and just different nonsense vocalizations as a way to communicate with you. And so, two important things that you always want to remember from our kids that are birth to 3 years old, the skill that you want to have them to develop by the time they're 2 years old is joint attention skills and turn taking skills. These two skills are the most basic skills for communication that any person needs in order to be able to communicate. Joint attention is when you call your child's name, they stop, they look at you. When they look at you, they're looking you in your face, in the direction of your face. They don't always have to necessarily look at you in your eyes, but they need to be looking in the direction of your face. And when you give them a verbal command such as come here, or go get your shoe, or show me the ball, that they can understand the command that you're giving them long enough by looking at you, processing it, and then following through on that command. All that kind of shows us, if they're looking at you, that means that they are listening and that they can process what they hear you say. Okay, and then the turn taking side of that is, first of all, once they process, how do they respond? If you tell them to go get the shoe, do they know first what a shoe is? What does it mean when you say go, which is an action word, that they can put all that together and go back and follow through on that command and bring you that requested item? If we take that to the expressive side, if you tell me, if you ask them, what is that? And you're pointing to a cup, that they can stop, look at you, listen to that question and say a cup. Or if you say show me the cup, receptively, that they can process that and they can point to or touch the cup that you asked them for. So a lot of times when children come in and these two skills are not intact, then these are the things that I use in order to get them to that point where we can get the joint attention and the turn taking established. That's more important than them being able to say words right away. It's more important than them being able to say their colors and their numbers. And let me just say this as a side note as well, because I don't want to make the video really long. As a therapist, I'm sometimes a little aggravated when parents come in and the children are like, I'll say anywhere between 15 months to almost 24 months, and you're concerned about whether or not they know letters, numbers, colors. Now, I'm not saying that any of those things are important, but they are academic skills, but they're also very rote skills. Like, you can say that to a child long enough, 1, 2, 3, 4, 5, 6, 7. That's never going to change. A, B, C, D, E, F, G. It's rote. It's the same. It's always going to go in the same order. The shapes are not going to change. The colors are not going to change. That's rote information that you can teach anybody. So just because a child can say that to you out loud, if you keep rehearsing that with them over and over again, it doesn't necessarily mean that they understand language. If you show a child what red is long enough, they can go and touch red, but do they understand that red is an adjective, that it's a color, that is used to describe something? Do you understand what I'm saying? So when I come in, when a parent comes in and they bring a child in and that's their concern, I'm like, at the end of the day, that's information that anybody can learn if you teach it to them long enough. They can just shoot that information back out to you, point it out to you long enough if you keep showing them. The thing that's important for kids that are birth to 2 years old especially is that they pay attention, with joint attention, they can process what you say and follow through on the command, and that they can do turn taking, which will eventually involve them being able to use words to name something or to answer a question that you give them. Because the most important thing that you want out of your child as they grow older, especially once they start daycare or they start preschool, is for them to be able to use their words to come back and tell you or communicate to you how their day was. So that's always the most important thing. So that this video is not long. The first thing that you want to remember, especially as a therapist and as a parent, when the child is not paying attention to you, if they're not using words, do not expect for them to have success overnight just because they started therapy, or just because you're looking at the tips and strategies that I'm giving you now and think that they're going to work right away. It takes time and it takes effort. The first thing that's very important is conquering the behavior of being able to sit down and being able to participate in structured activities, because a lot of times these children that have the low receptive language skills, the low expressive language skills, these are the kids that you can't get to sit down. They're all over the place. They want to grab this and they want to grab that. So what you want to do is that you want to, if you know that they are children that love to pull things off shelves and they don't like to sit down, clear your environment of anything other than the activities that you'll be using. Clear all of those things away so that they don't pull them down. And even as a therapist, as you can see, I have things that are hanging on the walls. On that shelf back there, I have some things. So for those kids that come in and do that, I have to put forth an effort to make sure that I clear all of those things out so it doesn't distract them and we can get to what we're doing. Okay, so clear the environment of things that easily distract them, at least for right now, so that you can get them to concentrate on what it is that you want them to do. So let me take a step back and let me show you the activities that I have. Okay, and I'm not going to, I've kind of discussed some of these toys in a previous video, but I don't know if I've done it from this particular point of view, but I just kind of want to show you what I have. So the very first thing I always like to do for these kids are my block sets. Okay, and it's a block sorter. Okay, so I'm going to pour some of these on the floor right now, a few of them in my hand. The important thing about this block set, I am not concerned when they come in that early if they can distinguish the shape and if they can find the right one. That's not what I'm concerned about. What I'm concerned about is being able to draw their attention in to the block that we're using, and I want them to process. First of all, I have them sitting in front of me, okay, and I don't give them access to the blocks. I take all the blocks out and I put them in my lap, or I put them under my leg with the child sitting in front of me, and I don't allow them, they're going to reach for it, but I don't give them easy access to this, because this is what I'm going to use to draw them in with. Okay, so I hold this up and I say, what is this? That's important. I want them to hear that question, what is this? Because that's something that they're going to hear all the time, and that's setting them up to understand what a question is. Okay, so even if they don't respond, I want them to hear the question, what is this? I wait a few seconds and I give them an opportunity to at least try and tell me what it is. If they don't tell me, then I take their hand and I put the block in their hand while I hold it, and I hold it up to my mouth and I say, this is a block. Block. I give them the word, I give them the beginning sound in the word, and then even if that's not enough, I also say, and this is the sound I use for block because it's more simple, block. This is a block. Now I'm telling you now, this is not the appropriate sign, but it's a sign that's been easy for my kids to adopt, and them showing me, because the other sign is kind of like this, and it's, for me, it's just too much. So I just say block. 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 And then once at this point, if they imitate, it's fine, but it's not required. If they respond right away, it's fine, but it's not required. I'm stimulating their language. I'm teaching them how to pay attention, and I'm not giving them quick access to the manipulative. I'm using that to draw them in so that I can work on their attention and get them to look at me, get them to look at my mouth and see how the word is formed, and then we take it and we'll drop it down in the box. So I'll say, okay, where do you think it goes? That's still another way to draw them in. When they go to the wrong one, which most likely they do, I say, uh-oh. Uh-oh is an easy word that can stimulate language and get kids talking. Uh-oh, let's try another one, trying to see if they can understand and to follow the command. And if they don't find it, and I say, okay, well, let's put it here. And when it drops down, whee, look, Your block is in the box. Wee! And we keep doing that, okay? We do that for however many of them there are. And then once it's all filled in, I hold this up and I say, okay, let's pick it up and pour it out. That's giving them a command, a two-step command. You're still giving them something to do. If they don't do it, which I don't expect they will, if the receptive and expressive is low, I take their hand over mine, I put my hand over theirs, and we pour it out. Uh-oh, they're all gone. There are no more blocks in the box. It's all gone. And we repeat this routine over and over. Okay, then once all the blocks are out of the box, because I still want them to stimulate their ability to try and say age appropriate sounds like B's, P's, M's, N's, W, H, T, and D, which are appropriate for birth to about 3 years old, or I say from 1 to 3 years old. Those are the sounds you expect them to do. Then I get the block and I drop it in the box. Boom! Can you do that? Let's try it again. Boom! And we keep going. Boom! And the three important things here that I'm trying to do in this one activity is that, first of all, I'm stimulating your language by drawing you in and controlling the manipulative, telling you everything that you're doing with it. And one thing that's important is whether or not a child can imitate motor movement. Speech is a motor movement. So if they can imitate dropping the block in the box, if they can imitate picking up the box and pouring it out, if they can imitate that motor movement, that is a key feature that I use as a therapist to let me know that they're within the proximity of being able to imitate a speech movement, because it's a motor movement. So if they can follow through on that, that lets me know that they can also try to get that movement here as well. And it's also another indication that they're processing information, because they're stopping enough to look at me, see what it is I'm doing, and they're trying to copy it. And that's working on them processing information and being able to do like a give and take. Okay, so that's how we use this activity. So I always start with a block set. Another thing I like to use is this card drop, and I use the same type of technique. All right, so the card is what goes with this one. I'll hold it up first and I say, what is this? This is a card. Now, K is not a sound that you would teach to children that are between birth and 3, but the card will draw them in, and I normally use, once the card goes down, here goes the card, beep, 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 down goes the card, beep, beep, go, card, wee, and if it gets stuck like it did, I say, uh-oh, it's stuck. And uh-oh and we and beep beep are still the types of words that you want to use for a child that's not using anything, to just kind of get them to using these muscles to start producing some type of word and some type of sound. And you always want to start with one syllable words that are open syllable words, where they don't necessarily have the vowel sound on the end. And then if you give one that is a CVC word, still make sure that it's one syllable and that it mainly contains those age appropriate sounds as a way to stimulate them trying to use words. So we will also use this as well. Another one that I use that's very, very similar is this one with the ball. Hold it up. What is this? Ball. Ball, 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 down, whee, and down goes the ball. So that's another one that I use. But in all of these, I'm making sure I'm controlling the manipulative, that I'm holding it up to my mouth so they can see me say the word, that I'm using the manipulative to draw them in to pay attention to me. So this is another one that I use. And then of course I still use the ball that we can roll back and forth, and I say wee, push the ball, wee, ball, all those things. Okay. All right, and this is another one that still involves the use of another ball, but for this one I say ball, in, button, push, ball, okay, and we do it just like that. You want more, you want to do it again, ball, in, button, push, ball, and that's how we do that one. And that's exactly what I say when I'm playing with them. All of those words will help to stimulate their language. I'm normally using hand over hand assistance. If they can't put it in, I'm making sure that every time they push the button, I say button, push, All of those are age appropriate sounds and words that you can use to stimulate the language. And then I'll say, oh, the monkey has the ball, or the elephant has the ball. All of those things just to draw them in and make them pay attention to what's going on. Okay, so basically, this was very short and quick. I just kind of wanted to give you, these are the activities that I normally use for my children that are coming in, that's not paying attention a lot, that's not saying a lot of words. And most times what I do, I end up using these same exact activities for at least 2 weeks to a month, maybe a month and a half. And once they start to be able to do these on their own, and they start saying the words that I have attached to each activity, the way I say ball, put in, button, push, when they start to give those things back to me, then I slowly start to fade those things out, and then I move them to more picture-based activities and puzzles. So I give you another video of what I use once they have gotten past this stage, but it's only to establish your joint attention and the turn taking skills. You're not putting pressure on them to respond right away or give you words right away. You're just establishing them being able to look at you, to imitate your motor movements, to be able to practice with just simple age appropriate sounds and words. And then once they do that, we move on to other activities that we can work on naming, answering questions, and then following more complex commands. So I hope that this helps you. If you have any more questions, feel free to contact me at the email address that will be listed in the description box.